Hi, this is Sean with the MassSupport Network here with a Massachusetts Public Health Report for Friday, September 18th, 2020. We're going to start by looking at cases in quarantine. These are people with suspected cases who are quarantining usually until they receive test results. So here's where we were last week, and here is where we are this week. Again, a slight reduction in number of cases under quarantine. This is, I believe, generally due to our increased amount of testing out there, that people are not waiting as long on testing. We're just getting to them faster. So we are able to confirm tests a lot better than we were earlier in the pandemic. And then as part of that, here is the confirmed cases and people going isolation. And this is where we were last week. And here's where we are this week. A slight uptick here. Now, some of this is going to be due to college testing, which we'll get to in a minute. But also just a lot more probable cases are being confirmed these days. So although the cases are higher, it seems like we're still doing better, even though it is kind of counterintuitive and often confuses me. Looking at our hospitals, though, we do actually have an uptick in hospitalizations this week, basically across the board. Hospitalizations, ICUs, and intubations are all higher. So that's the more concerning statistic there, rather than just the raw cases there. But again, these numbers are getting to the lower point where they tend to bounce around, where a very small number of new hospitalizations or intubations is a drastic increase. When we have only 21 people intubated last week and 5 new incomes, that increases it almost 25%. Whereas early in the pandemic, when we had over 800 people on ventilators, another 5 cases wouldn't have made a difference. So looking at who's currently getting infected right now, the average age of total cases in the last 2 weeks is down to 36. That dropped a year down from last week. So a lot of the new cases are in younger people. The largest demographic of new cases is 20 to 29. And the 10 years on either side of that are pretty high as well. Those really young people who are getting infected these days, and that may be due to decreased restrictions and people feeling like they don't have to take as many precautions, or it may have a lot to do with schools reopening, because that's where we're going to see a lot of college students, younger teachers in primary and secondary schools, et cetera. Hospitalizations, however, is up 1 year there. So the 60 is the average age for someone being hospitalized, and deaths is at 79, down from 80 last week. And again, those two numbers are going to bounce around, especially because there are very few people in general dying and being hospitalized. So checking with our contact tracers, this is how we're doing right now. We're still steadily reaching initial cases and doing the major part of their contacts for outreach. And across the board, we are increasing the outreach there. The case outreach is up 0.1% from last week, and the contact outreach is up 0.2%. So we're steadily making up there, but that accounts for about 2,000 more people, both in terms of cases identified and their contacts who are potential exposures there. So we're still making our way through there. So let's look at communities across the state and how the incidence rate is doing. So here is how the state looked last week. This is only reporting areas that have 5 or more cases, and it is the number of cases per 100,000 people per day over the last 2 weeks. So this is where we were last week, and here's where we are this week. So as you can see, the west of the state is pretty dry right now. It's the eastern part that's really focused on, and we'll look at those communities specifically. But remember that to show up in this map, the town needs to have at least 5 cases. That means a small town that only has 3 cases could have an incident rate of 10, which would be well into the red if it was any other town there. But because the raw numbers of the cases so low, it's not going to show up on the map here. There have to be at least 5 cases in a town before it appears on this map. And we'll talk more about that in a second as well. But first, those towns in red, in case you're wondering how those are doing. Here are the communities with more than 8 cases per day per 100,000 people, as well as how many cases they saw in the last 2 weeks. So some of these, that 8 is a pretty small number. So some of them, like Monson, Linfield, and Plainville, are not actually seeing a whole lot of cases, but are still falling into that red because we want everything to be lower. But then a lot of them are still showing a considerable number of cases. Places like New Bedford, Worcester, Framingham, Lawrence. Noticeably absent from this list is Boston, which, despite having 750 new cases in the last 2 weeks, is so large that those 750 cases work out to less than 8 cases per 100,000 people. It's kind of an interesting way how these numbers break down. So let's take a look at the percent positivity across the state. This is the percentage of tests that are coming back positive in any given area. And it's mainly that shows that we're doing enough tests in a given area to catch all the cases there. So this is last week, and here's this week. You'll note that the percent positivity for the state has actually dropped a bit there. We're getting even lower. We're down to 0.9%, which is, I believe, the lowest it's ever been, which is great. But now this is what I was talking about earlier with small towns that have a high percent positivity, but so few cases they don't show up in that earlier map. For example, the town of Hancock, which is this long, thin, dark blue line on the very left side of the map, that has an incident rate of 11 per 100,000 people. However, that's only 1 case. And there was only 10 state tests conducted in that town, so it ends up with a very high percent positivity and incidence rate, the fact that it doesn't show up in the early map because there's so few actual cases there. And this is just a bunch of different ways you've got to kind of keep thinking about these ways to see where actually is a big source of spread or not. Okay, now let's talk about higher education, because a lot of colleges are coming back. Not all of them, of course, but many of them are coming back, and those that are generally doing very aggressive testing regimens. So in the last week, there have been 168 COVID cases associated with higher education, which is out of the 500 or so total that have been since schools reopening. But there have been over 500,000 tests conducted, especially with colleges reopening, with 150,000 of those in the last week. Massachusetts just passed 2 million total tests. And so as you can see, about a quarter of those were conducted recently in terms of colleges reopening. So a lot of schools are taking this very seriously. So how is that driving our spread there? Well, at the top there, you can see the percent, basically this is the percent positivity in college testing. And this is going to be much lower than the regular positivity because we are testing plenty of people who there would be no reason to test otherwise. People who have had no history of exposure, who are showing no symptoms, who seem perfectly healthy and have not been around anyone infected. So we're just throwing out just to be double sure. And this is why the percent positivity is less than 0.2% there. And then, but the lower one is quite interesting. That is the percent of confirmed cases in the state that are associated with this higher education testing, with college testing. So that is a much higher number, of course, and that's bouncing around a bit there. But the eyeball average is about 5% of confirmed cases in the last last month or so are associated with colleges reopening. So that does show that that is still a noticeable source of spread, especially on some days there when back in the first week of September, it was accounting for a very significant fraction of cases across the state. So then looking at the state totals then, this is the 7-day average of new cases over the last 2 weeks. So we've kind of wiggled around a little bit here. Say we are slightly higher than when we started 2 weeks ago, but we're staying, in the more or less in the same range between 290 cases a day and 350 cases a day. This is up from where we were in August, of course, when we were in the upper 200s for most of the month there. We'll see how the fall goes from here. And one last thought to go out into the weekend with. This was perhaps one of the best metaphors I've seen for explaining COVID spread indoors and outdoors, if perhaps one of the grosser ones. COVID-19 indoors is like peeing in a crowded hot tub. You might want to wear a well-fitted dry suit and change the water frequently. COVID-19 outdoors is like peeing in the ocean. You might not want to stand right next to other people. And this is the poster is a indoor air quality researcher. This is kind of a good, a good if slightly gross way to think about how COVID spreads indoors versus outdoors. All right, for more of the MassSupport Network, you can find us online or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.